As a curious pet owner, have you ever taken to the internet for more information? Maybe you want to know why your pet is itchy and what you can do about it. Maybe you're frustrated about the ear infections. Maybe you're looking for ways to make veterinary care more affordable. Instead of wading through a sea of information that may not be reliable and in some cases may be harmful, here is what your vet wants you to know. I'm Dr. Brittany Lancelotti, board-certified veterinary dermatology specialist. Join me to get the information you're looking for to care for your pet. If you're curious about your pet, then your vet wants you to know. I've mentioned this before, but allergies are one of the most common reasons that people bring their pet to the vet, and they're one of my favorite things to talk about. We've previously talked about flea allergies in episode 1, and if you haven't listened to that already, I would highly encourage you to go back, listen to the episode about fleas and flea allergies, because this is the most common type of dermatitis we're going to see in dogs and cats. Flea allergies are diagnosed and based on the appearance of the dog or the cat. Typically in dogs, you'll see hair loss, redness, crusting, itching on the base of the tail, their rump, and on the inside of their thighs. Cats will often have hair loss on their back, their sides, their belly, and their back legs, but you can also see redness and crusting on their skin, as well as really large red plaques known as eosinophilic granulomas. There's some really great pictures of these on the website in the show notes for episode 1. And while it is helpful to find either fleas or flea dirt on the animal's skin, these don't necessarily need to be present in order to diagnose a flea allergy. The diagnosis is made based on the appearance of the dog or cat's skin problems and a lack of an effective flea prevention. The good news is that this is fairly easy to treat by addressing any secondary infection that's been caused with either a medicated shampoo or an oral antibiotic, some type of itch relief to get the animal feeling better, and strict year-round flea prevention for all pets in the household. Food allergies are diagnosed based on response to challenge feeding with a food to which the animal is allergic after an 8 to 12 week washout period with a prescription elimination diet trial that can either be hydrolyzed or novel protein. We talked about food allergies extensively in episode 2. The long-term treatment for food allergies is avoidance of the protein that causes the allergic response, as well as some symptomatic anti-itch medication if they happen to counter-surf and grab something that they're not supposed to. Or if my father-in-law comes to your house for a visit and brings the bacon that he keeps hidden in his pocket for the dogs. So now that you have a better understanding of flea and food allergies, today's episode is going to focus on environmental allergies. I'd like to politely ask that you take a look at that ugly mug you see on the podcast art. That scruffy face and snaggletooth, they belong to my dog, Russell Sprout. Russell ran out in front of my car when I was driving to class during my first year of vet school. Don't worry, I didn't hit him. I pulled the car over, scooped him up, and tried to figure out where he came from. And no one claimed him. He became part of our family. He also became the inspiration behind my love of dermatology. Russell developed seasonal allergies. And the first summer that I had him, it was really mild. We managed with lots of medicated baths and just a touch of steroids for a very short period of time. But by the time I got to my 4th year of veterinary school, his allergy season was longer and much more severe. Luckily, it was at that time that I had my dermatology rotation. And with the help of my lovely mentor, we allergy tested Russell and I got him started on allergy-specific immunotherapy, also known as allergy shots or allergy drops. I was completely fascinated, fell in love with the subject and with that clinic, and I wound up doing my residency there after graduation and internship. As a result, environmental allergies are one of my favorite things to discuss. And as I mentioned in our episode on food allergies, the clinical signs of environmental allergies can look almost identical to food allergies. There are some things that we can use to raise or lower our suspicion of whether it's food or environmental, but it's important to understand that the diagnosis of environmental allergies, which is also known as atopy, is a diagnosis of exclusion. And what this means is that you've gone through the steps to rule out all the other causes of itch, like infection or fleas or food allergies, and all you're left with are environmental triggers. Some of these little things that we can use to increase our suspicion of environmental allergies would be age. So like I mentioned before, food allergies typically appear in much younger animals, whereas environmental allergies usually begin between 1 to 3 years of age. But there's some wiggle room on either side of that. Like I mentioned previously, not all dogs read the textbook. It is unlikely to see older dogs develop environmental allergies if they haven't previously had skin disease, unless they've moved to a different geographic region in the last year or two. Seasonality would be a big indicator that environment is more likely the cause of the allergy. So if the animal does totally fine throughout most of the year, but during certain months they are uncontrollably itchy, there's probably something blooming during that time that's causing an environmental allergy. One important thing to mention is that as an animal ages, their immune system becomes more and more triggered with each allergy season. So they can start off by being very, very small season with their allergies, progressing to longer allergy seasons, and then eventually potentially develop year-round allergies if the underlying allergy is not addressed. The last difference between environmental and food allergies is that environmental allergies don't typically cause gastrointestinal issues, but as I mentioned before, food allergic dogs may or may not have gastrointestinal issues. When it comes to a diagnosis of environmental allergy, if an animal clearly has a seasonal component to their itch, I usually don't wait to do a diet trial before I diagnose an environmental allergy. If the itch is non-seasonal, so it's present all year round, I'll usually start with an elimination diet trial, and before we challenge feed to determine if there's a food allergy, I like to see how itchy the animal is off all anti-itch medication and just on the prescription diet alone. So if the itch comes back pretty quickly after stopping their anti-itch medication, but before we've introduced any other food into the diet, I'm pretty confident that there's an environmental component to the animal's allergies. Once we've reached the diagnosis of environmental allergy, I need to discuss what that means for the pet and the owner. For the overwhelming majority of pets, allergies are not something that we can cure. There's something that we're going to manage long term. So I do my best to manage allergic animals with the safest, most effective medications. When I think about medications used for environmental allergies, I like to put them into two big categories in my mind. The first category is symptomatic treatment. These are medications that are designed to treat itch and inflammation. Medications that I include in symptomatic treatment are steroids, cyclosporin, also known as Atopica or Cyclovance, as well as other forms of cyclosporin, Apoquel, Cytopoint, and one of our newest medications, which is Zenrelia. All of these medications will treat symptoms of allergy, but if you stop giving the medication, the allergy is still there and the animal will start itching again. You'll notice I didn't mention antihistamines when I talked about the medications I include in symptomatic treatment, and that's because typically for dogs with environmental allergies, less than 10% of them will respond to an antihistamine. So it's not something that I think is effective enough to consider as my symptomatic treatment. Bathing is also a really important symptomatic treatment, and almost all of my patients are prescribed a medicated shampoo to use on a regular basis. Bathing with cool water removes pollens from the surface of the skin. It repairs the skin barrier, so pollens the animal comes in contact with are less able to get under the skin and cause an allergic reaction. And medicated shampoo is often antimicrobial, so that reduces the recurrence of skin infections that are common in pets with allergies. The other category of treatment for environmental allergies is desensitization, and this is my preferred treatment for environmental allergies long term. What desensitization means is that we're training the immune system to be less reactive to the things in the environment that it's currently overreacting to. Desensitization minimizes the amount of symptomatic treatments that we just talked about needed on a long-term basis. To find out what the immune system is overreacting to, we perform allergy testing, and this can be done with either intradermal skin testing or blood allergy testing or both. Intradermal skin testing involves giving the animal a mild twilight sedation so that it holds still, doesn't feel the injections that we're giving into its skin. And then once the animal is sedated, a patch of hair is shaved on the side of the body and a series of about 80 or so injections are given. What happens next is we watch for a reaction of the skin at the site of the injection to determine which allergens the animal is allergic to. That reaction is the release of histamine from mast cells that live within the skin. Skin testing does require animals to be off certain types of medications, such as steroids and antihistamines, which can interfere with the skin reaction that we want to see. In certain breeds, such as English bulldogs, French bulldogs, or any of those other smush-faced breeds, technically known as brachycephalics, this may require general anesthesia, and that's to protect the airway because these breeds tend to have difficulty breathing. The results of the skin tests are available immediately. The sedation is reversed and the animal goes home shortly after the procedure is finished. Intradermal skin testing should only be performed by somebody who has received special training in this procedure, like a veterinary dermatologist, so that they understand how to perform the test appropriately and interpret those results. Blood allergy testing involves pulling a blood sample and sending it to a very specific laboratory that evaluates circulating antibodies to different environmental allergens. For blood allergy testing, animals don't have to be sedated and they don't have to stop any medications. So this is a good alternative for some patients where you can't get them off steroids or a sedation might be too risky for them. Depending on the lab that's being used, results can take 1 to 2 weeks. If there's not a veterinary dermatologist in your area, this can be performed by your family veterinarian, and most of these labs that run blood allergy tests have a specialist who can help your family veterinarian interpret the results. Some dermatologists prefer to perform both skin testing to look for that histamine release within the skin and blood testing to look at the circulating antibodies to give them as much information as possible when coming up with a recipe. Whatever testing your veterinarian decides to go with, the goal of the testing is not just to see what the animal is allergic to in the environment. In contrast to food allergies, where your goal is avoiding the thing that the animal is allergic to, there are very, very few allergens in the environment that the animal can effectively avoid. Things like dust mites, which are a very common allergen, are everywhere in the environment, and they're impossible to avoid. The goal of allergy testing is to use those results to guide your treatment based on what the specific animal is allergic to in the environment. We come up with a recipe for allergy-specific immunotherapy for that individual pet that desensitizes it to its specific allergens. Desensitization is through either allergy shots, which are given underneath the skin, usually by the shoulders, or allergy drops, which are administered using a small pump to give drops underneath the tongue. There are some dermatologists who are doing intralymphatic desensitization, including the dermatologists at Veterinary Skin and Ear in Southern California, where you can come consult with us if your animal is allergic. With intralymphatic desensitization, the animal gets an injection directly into their lymph node. That would be something that's done under the guidance of a veterinary dermatologist and not done at home like the allergy shots under the skin or the allergy drops under the tongue. Because the allergy shots are given by pet owners at home, there's no need to come into the vet each time the pet needs an injection. Russell is not a happy-go-lucky golden retriever who will let you do anything that you want to them. He is as feisty as he is ugly. So if he can be trained to look forward to getting his allergy shots, I truly believe that most pets can successfully receive their shots at home. Depending on which study you look at, about 65 to 75% of dogs who are being desensitized will have improvement of their clinical signs related to allergies. And that means a reduction in both the itch and the recurrence of secondary infections. And that leads to a decrease in the need for those symptomatic medications over the course of their lifetime. About 10 to 15% of animals may have some type of seasonal flare in which they require a short course of anti-itch medication to help manage the flare. And about 10 to 15% of animals may not respond to the allergy shots. For those pets, we work on finding the safest, most effective symptomatic treatment to manage their allergies long term. Because desensitization is retraining the immune system, it takes some time to become effective. It's important to expect that your animal will likely be on some type of other anti-itch medication for up to a year after starting allergy shots. Some pets may respond to the shots within the first 6 months, which is great, but usually around 10 months or longer is more likely. There are a lot of different protocols for how often allergy shots are given, but the goal is to be able to reduce the frequency with which the animal is getting injections once we're past the induction stage, when we're just starting out, and into the maintenance phase. Most animals who are maintained on allergy shots in our practice typically need injections once every 2 weeks, but every animal is different. So it's important to have an ongoing relationship with a veterinarian who's comfortable with long-term management of environmental allergies, like a veterinary dermatology specialist. And for some patients, after a few years of allergy shots, we can reduce the frequency even further. Allergy drops, which are a liquid given underneath the tongue, are a little bit different than the shots. They're also given by the pet owner at home. However, instead of getting into a maintenance phase where they only need the shots every 2 weeks, the drops have to be given twice a day, every day, in perpetuity. So kind of a drawback there as far as reducing the frequency that you're needing to give the treatment. It is important to understand that allergies are a chronic skin condition, and unfortunately, they do require lifelong management. Effective flea prevention is critical for any patient with allergic skin disease, and about 80% of animals with environmental allergies are also allergic to flea saliva. It's really tough to tell the difference between food allergies and environmental allergies just based on the appearance of the animal alone. So working with your veterinarian to figure out what the primary cause is going to go a long way towards minimizing your frustration. It's possible for animals to have both food and environmental allergies. Making a prescription elimination diet trial under the supervision of a veterinarian, important important for that definitive diagnosis. Long-term management of food allergies is through avoidance of the protein to which the animal is allergic using a prescription diet. Itch from allergies can be used using symptomatic medications like steroids, Atopica, Apoquel, Cytopoint, Zenrelia. The only treatment that actually retrains the immune system to not overreact to the things in the environment that the animal is having a reaction to is either allergy shots or allergy drops formulated for the individual pet based on either skin testing or blood testing or both. If your pet has allergies, I recommend reaching out and talking to your family veterinarian. You can also visit our website, yourvetwantsyouToknow.com, and go to the resources tab where you can find a link to search for a veterinary dermatology specialist near you. If you are in the Southern California area, you can always schedule an appointment at Veterinary Skin and Ear with myself or one of the other great dermatologists that are looking forward to figuring out your pet's allergies with you. Thanks so much for joining me. I look forward to your next visit with Your Vet Wants You to Know.